Anyway, so here's your femur, and does anyone know if this is a right or a left femur?
This is right.
Left femur.
Oh.
Which is it? I can flip. It's actually a right femur.
Oh,
Right.
All right. All right.
That's
So
right.
here's our femur. Actually, it's probably easier for me to just hold it up like this. So, long bone structures. What's this part of it called?
Yeah,
Yeah, the
diaphysis.
diaphysis. Okay. What's the parts here and here?
Epiphysis.
Yeah, that's the epiphysis. Okay. What's the name of the connective tissue that surrounds the outside?
Periosteum.
That's the periosteum. Good. You can't really see it unless you cut through, but what would that line
Disc.
be called?
The
That cuts across.
the disc.
Yeah, the epiphyseal line. Okay,
Line.
good. Now, it's also not shown on this model, but what would you have sitting on top of here and sitting on top of there?
Cartilage.
The
You'd have the
articulated.
articular cartilage, good. All right. If I cut this, okay, cut it in cross-section, what would the bone be that I would see in the diaphysis? What type of bone?
Compact.
Compact.
That'd be compact. Would I see solid bone all the way through?
No.
No. What would be in the middle?
Medullary cavity.
No, the medullary cavity. Ow.
Medullary.
Medullary cavity would be in the middle, or also known as the marrow cavity.
Yes.
Okay. What would be inside the marrow cavity?
The bone marrow.
Yellow.
Red.
Yellow
Red
marrow.
and yellow.
Okay, the fatty type of marrow. If I cut through the epiphyses and looked in, what type of bone
The
would I
red
see
bone
there?
marrow.
See
Spongy.
spongy bone. What would be inside the spongy bone?
Red marrow.
Red bone marrow. Good.
What's my phone?
What else? Oh, if I cut through the diaphysis and I looked at that medullary cavity, what's the name of the connective tissue that lines that?
And
And
The endosteum.
endosteum.
Okay. All right. All right. I think that's about it. So this shouldn't be too tough. I could show you a femur, or it could be, a humerus, just whatever. You won't have to. I just was asking you that. I'm not going to ask you for the specific bone just yet. That'll come later. All right. Types of bones. Okay. Make sure you can identify some of these bone examples that I give you here. Okay. So if I pointed to a bone like this and I said, what type of bone? You'd say long bone. Okay. What if I pointed to like these guys that make up your phalanges? What are those?
Long bone.
Those are also long bone. Okay. What about these little bones here?
Short bone.
And what are they? Those are short bones. Okay. What if I pointed to one of these guys?
Irregular.
That's irregular. What is that, by the way? Yeah, that's a vertebrae. Good. I don't have my patella with me, but if I pointed to like a little patella thing, it would be a sesamoid bone. Okay. And so something like, what if I pointed to your frontal bone here?
Flat.
That's a flat bone. Okay. So, I could show you a model of like the humerus or one of these things that listed here, and I could ask you what type of bone is it, or I could say, give me an example. I could just say, give me an example of a long bone, and then you'd have to tell me a bone that's a long bone. And you could say humerus like it's listed here, but I'd accept credit for anyone. As long as it's correct, if I said, give me an example of a long bone, you don't have to put humerus like it's listed there. You could say anything that's correct. So you put femur, whatever. All right, bone surface markings. Make sure you know these definitions, okay? And I'm going to show you them now, maybe just to help you remember them, but for now, you don't need to identify them on models, per se. So the first thing is a condyle. It's a rounded bump, usually fits into a fossa to form a joint. So here is your femur again, okay? The rounded bumps at the bottom here, okay? Oops, let me go this way. And let me back it up. Okay. These rounded bumps at the bottom here, those are the medial and the lateral condyles of the femur, okay? And they form a joint with the tibia, okay? So those are condyles. Sitting on top of the condyles of some of the bones, so like the bony part that's up here off to the side, and over here, the little bump there, those are called epicondyles, okay? They don't form the joint per se, but they serve as a point for different muscles attaching to the epicondyles, okay? What does the prefix epi mean? Does anyone remember?
Top.
Not top, it means to...
Surround.
Not surround, that's Perry. to cover. Okay, so the epicondyle covers the condyle, so it's it's basically sitting here on top of the condyle. All right, so that's the epicondyle. Facets are flat areas where you typically have a joint, a facet creating one facet pressing against another facet, creating what's sometimes referred to as a sliding type of a joint. We'll talk about the different joint types, but the best example of facets that I can give you would be like on some of the vertebrae. Okay, for example, these little guys here and there are called the superior articular facets. Okay. If I go to the bottom part, this flat area here and there are the inferior articular facets, so that when your vertebrae fit together, for example, should I get this right? They sit like this. Okay. You can see how the little flat areas rub against each other. Okay. That's how your vertebrae basically form their joints. So in the space that's between them, what would be where my finger is?
Intervertebral disc?
Yeah, that'd be the intervertebral disc, but you can do things with your spine like lean to the sides, okay? That leaning to the sides or that twisting that you do a little bit, that's all related to those facet type of joints that you have in the back there.
So we learn more.
A foramen is a round hole, okay? Best example I could give you, there's something called the obturator foramen, which is the biggest foramen in your body. That is on your pelvis. That's this big hole here. That's the obturator foramen. You haven't really studied the pelvis yet, but you have talked about the brain already in the other chapters. The other big hole, the other big foramen is this guy. What's that foramen?
Magnum.
Yeah, that's the magnum foramen. Okay. Does anyone remember anatomically what that divides? When you're superior to it, what do you have?
The medulla.
Specifically what? Yeah.
Medulla.
The medulla, and right when you're inferior,
Spinal
it's
cord.
it's the cervical spinal cord at that point. Okay. All right, so that's an example of a foramen. A fossa is a depression on bone, often receives an articulating bone. One of the best examples I can give of that is here is your left arm, okay? And if you look on the back side, does anyone know what this bone is here? You got a 50-50 chance probably. This is the ulna, okay? The end of the ulna, hold it up here. The end of the ulna has something called the olecranon. Okay, so that's your ulna. That's the end of the ulna. And when you extend your arm, in other words, when you take your arm and go like that and extend it, like when you're using your triceps muscle, okay, what happens is that olecranon fits into a little fossa that's inside of your humerus. So this is your humerus. You have a little fossa, a little depression at the end of your humerus that allows this part of the ulna to fall into it. So when you extend your arm, it's like this. See how it fits inside that little fossa? Okay. So that's an example of a fossa. That happens to be called the olecranon fossa.
So is it the olecranon on the other side?
It is. So this part, the part that forms the bone of your elbow, is the olecranon of your ulna. And when you bend your arm, the olecranon part of your ulna fits into that little olecranon fossa that sits on the humerus. Meatus, you already, head. Head is next. Anytime you have a rounded, almost totally circular projection off of the bone that forms a joint, you can call that a head. Okay. This is the femoral head. Where's another big spot where you have a head on a bone? Anyone know? So this is the femur. The femur is to the pelvis as what bone is to the shoulder? The humerus. Okay, the humerus has a head as well. Okay, so there's a femoral head and a humeral head. But it's basically a round or spherical shaped projection. Okay. Now, just since I'm here, just like your body, everybody has a head. What comes just below your head?
Neck.
Your neck. So just below the head of a bone, you have the neck of a bone. Okay. So you can talk about the neck on the femur or the neck on the humerus. Let me go back then. Meatus is a tube-like opening. So with a foramen, it's a hole, but it's not tube-like. It's just a hole. With a meatus, it's a tube, and you've already studied one meatus. What was the meatus you guys studied?
External.
Acoustic
Yeah, the
meatus.
external auditory or the external acoustic meatus, whatever you want to call it. And you can actually see it. It's this little guy here. This is your temporal bone, and that hole going through there is actually the hole that you studied already. Okay, obviously there's skin over it, but that's the hole. Okay. And then a trochanter. Those are large bumps for attachment. Honestly, I think the only place you really talk about the trochanter, is on the femur itself. It's these two big projections that you have on the femur. The bigger one is called the greater trochanter. The smaller one is called the lesser trochanter. Okay. All right, that's that. Let me go through the microscope stuff now, very quickly.
Yeah, absolutely.
There's a trip. Okay. What type of tissue is this without looking at the top? Yeah, this is hyaline cartilage. Okay. Hyaline means, I smell maple syrup. Anyone having pancakes? Anyway, that hyaline means like ground glass or glassy appearance, and the reason for that is that the extracellular matrix, you really can't see individual collagen or elastic fibers. It just kind of looks like this hazy pink area without well-defined fibers. So if you see, it's either hazy pink or it's hazy purple, but the point is you don't see any well-defined fibers. So that's a tip-off that you're looking at hyaline cartilage. Okay. If I pointed to this little guy here, not the white part, but the actual guy inside the white part, what would you call that?
Chondrocyte.
Yeah, that's a chondrocyte. The outer white part represents what?
Lacuna.
Yeah, that's the lacunae. Okay. I told some of you guys, it's often in how I ask the question. Like I could circle this and say, what's the space? Or I could say, what cell is represented here, or something like that. So if I ask about the space, say lacunae. If I ask about the cell, say chondrocyte. And don't get messed up with the cell types. Make sure that if you're looking at cartilage, you call it a chondrocyte, whereas if you're looking at bone, what do you call it? Osteocyte. All right. So there's one hyaline cartilage. Here's yet another one. Again, it's a glassy appearance. There's no well-defined fibers. This is what type of cartilage? Anyone know? This is fibrocartilage, okay? All of those big fibers that you run are really tough collagen fibers. A tip-off with fibrocartilage is that the chondrocytes tend to line up in rows, okay? So you can kind of see them all lined up in rows. Okay, that's a good tip-off. But you still have the same terms. You can still talk about the chondrocyte inside and then the surrounding lacunae. Okay? The other part is all extracellular matrix, and you can see fibers. Unlike hyaline, you can't see the fibers. You can actually see fibers, and they represent tough collagen fibers in the case of fibrocartilage. This is the type of cartilage you see in your intervertebral disc. Here's another picture of fibrocartilage, maybe even a better picture. Notice how these pictures don't look anything like the fibrocartilage they showed you in the book. All right?
Yeah.
Those are crappy pictures. Anyway, all of these big pink things running this way and that are thick bundles of collagen, and you can still see how the nuclei or how the
Lined up
chondrocytes
together.
are kind of arranged in lines. Okay. What's this type?
Elastic.
That's elastic. Can you see the actual individual fibers there?
Yes.
Those are elastic fibers. They're relatively, this is high magnification, but they're relatively fine fibers. Okay? And again, you have chondrocytes inside a lacunae. Here's another picture. Again, you can see some individual fibers that are inside of there. That's elastic cartilage. What's this?
Compact bone.
Yeah, this is compact bone, and what's this whole guy?
Osteo.
Yeah,
Osteo.
and the thing in the middle is the
Central canal.
central canal. The little things radiating outward are coming out from, those are canaliculi. Like picture it like the sun. Here's the sun. The little radiations are the canaliculi. The black dots are what? What are the little black dots? Those are the lacunae. Inside of there would be the osteocytes. Okay? And then the layers that you see going around in a circle are the what? Those are the lamellae. Okay, they're not super well defined, but anyway, same type of deal. Going around in a circle are the lamellae. The central part is the central canal. The little tiny black dots are lacunae with chondrocytes.